one life, you're a hero. Save 100 lives, you're a nurse. This is a quote by The Unknown. Why are nurses even important to us? This is the person that you are going to see the first when you go into the doctor's office and spend the majority of your time. So it can be beneficial to know a little bit about the person that you have your health in the hands of. I'm someone that wants to go into the nursing career and have done a lot of research on schools, programs, and everything that goes into the nursing process. And I think I have some useful information to share about that. The process to become a nurse can be difficult, but in the end it is a rewarding career. Today I will cover the process of nursing school and what is involved in it, the struggles and hardships that nursing students will face, and the possible options for furthering your education in the nursing field. As we look into the nursing career, we need to first understand that nursing school can be a very involved process, but it has a lot of unique experiences. Some of the prerequisite classes that you will have to take are Anatomy and Physiology 1 and 2, Core Communications like this class, which is why I'm taking it, Basic Maths, and Sciences that are based on the medical field. In order to get into nursing school, the minimum requirement of GPA is a 2.5, but a lot of schools will not even accept people with this low of GPA. So in order to be competitive in the program, you will need to get A's and B's in the majority of your prereq classes to even be considered to these very competitive schools. There are several classes that you'll need during the getting your BSN. There will be less classes you'll have to take in different classes if you're just getting your RN, which is a registered nurse. This is an associate's degree in nursing, and then the BSN is a bachelor's degree in nursing, so you'll have longer schooling and more classes you'll have to take. Some of the classes you'll have to take is Nursing 312, so like pharmacology and nursing, which goes over the drugs and how they affect the human body. Nursing genetics, which goes over the genetics of the human body. And then the Nursing Research 1 and 2, this will allow students to do research on past cases and get an idea of what's going on and prepare themselves for the real world. All nursing schools require stimulation labs. This is where the students will go in and have a real life experience where their instructor will go into a room and they'll control for lack of better words, a dummy, and this person is able to talk, communicate with you, tell you what's going on, and bleed, and do anything a real person could do without the possibility of hurting a real person. So this is a way that the students are able to practice in a real life scenario without actually hurting somebody, which is why the majority of schools will use this and can be very beneficial in the learning process rather than pretending something's going to happen. It helps you prepare better for your clinicals, which clinicals are 12-hour days that you'll have to spend in order to pass your nursing program. Before you can go into to become a nurse, you have to go through the struggles and hardships that come with the schooling. You'll have to deal with classes that are much harder than in your prereq classes, so you'll need to spend more time studying than you would regularly in your prereq classes, which is why a lot of students actually fail because they're not used to taking more time out of their life for studying, and this can be hard on those students to transition into this. Like I said, clinicals are 12-hour-long days where they have to sit in like a hospital or nursing home and actually take care of real human beings with the risk of possibly harming somebody if they do something wrong. So it can be a stressful 12 hours, and they have to do this on their weekends a lot of times, which is outside of the class. So this takes away from their studying and can be a lot to take in when you transition from having an easier prereq classes and now you're in nursing school. It's really fast paced and a lot going on. Many students also struggle keeping up their social life in school. They will want to go out and party like they did previously or hang out with their friends and not take time to study, which can be one of the big factors is why people will drop out from nursing school or why they will fail. Once the struggles are overcome, you have future decisions to be made. This is where you need to choose what you want to do in the nursing field. You can have the option of becoming, for me, I want to become a nurse anesthetist. This is the person that takes care of the drugs while somebody is in surgery. They work alongside of an anesthesiologist. They pretty much are like an anesthesiologist. They just get paid less and do a lot less schooling. It's about 2 to 3 years more after the actual nursing program. And it pays a lot of money, which is why a lot of people like it, but you also have very expensive schooling to go along with it. The next is a nurse practitioner. This is like a doctor. It's one of the most common fields that people go in the nursing field. They work under a doctor and can prescribe drugs, and a lot of times this is who you see when you go to the doctor's office. Another thing that you can do is a specialty, so like a surgical specialty, so you help during surgery, you hand the doctor or surgeon the instruments and help with that. You can work in the ICU, which is where people that are in severe care are, with babies, pediatrics, and even in the ER. There are many different types of possibilities for specialties, and a lot of people will choose a specialty over going to further education because they don't have to take more schooling, they'll just do on-the-job training, which is why it's very common that people will do this. Now we can all see how difficult the nursing process can be, but in the end it's such a rewarding career. Today we covered the nursing process and what goes into it, the struggles and hardships that nursing students will face during this process, but in the end it's well worth it. And finally, the options for furthering education in the nursing field along with specialties that you can go into. Now in the future, if nothing else, you may choose to become a nurse or going into the career, or at the least have more respect for the nurses.